So is it audible, everyone? Good. So we'll be discussing all the previous year questions of your NEET exams. So the questions which are from important topics which are repeatedly asked, we'll be throwing some light on all those questions. See the question number 1. Yes, good. See the question number 1. Which of the following vaccines do you recommend for a 10-year-old school child according to National Immunization Schedule? This is the question. Which of the following vaccines will you recommend for a 10-year-old child according to National Immunization Schedule? So the question is on NIS, National Immunization Schedule. Na? So 10-year-old school child will get TD vaccine. Previously it was TT vaccine. Now we are getting TD vaccine. TD first dose at 10 year. TD second dose at 16 years. Good. TD second dose at 16 years. So the first dose at 10 years and 16 years we are giving second dose. So what was used before? Tetanus toxoid. So if they mention 10-year-old, the answer is TD vaccine. Study was conducted among two groups of people working in aniline dye factory for 20 years. So they are dividing the set of workers into two groups. Working in factories, the other workers were official workers of the same factory. So see the question. The word risk is very important. When the word risk comes, it is incidence. What is one more noun for risk? It is incidence. The risk of getting, like for example, risk of developing cancer was assessed using existing records. So the word records will be there. Exposed workers, non-exposed workers, exposed workers, non-exposed workers. So see the words properly. Exposed, non-exposed. Usually they ask questions on occupational exposure. Usually they'll be asking questions on occupational exposure. Records. The purpose of doing such a study is to save time and cost. To save time and cost. When you have incidents with you, listen to the words properly. When you are having incidents with you, two things you can calculate. Mainly the incidence in exposed, the incidence in non-exposed. When you are dividing these two things, incidence in exposed divided by incidence in non-exposed, you'll be getting what ratio? Tell me very good. You'll be getting what ratio? Risk ratio. Risk ratio. So the study is not concurrent cohort study. It is not a prospective cohort study. It is not a concurrent cohort study. It is non-concurrent cohort study, also known as, what is one more name? We have discussed the same example in the class. We have given the example as rubber and bladder carcinoma in your class notes, if you can check. In the exam, question was almost similar to this. Aniline dye and official clerical workers. It is retrospective cohort study. Retrospective cohort study. The main advantage is saving time and cost. In cohort study, always remember we are comparing the incidence in exposed and incidence in non-exposed. We are calculating risk ratio. But what about case control study? Tell me, what about case control study? What we will be comparing in a case control study? We are comparing the exposure pattern. We are comparing the exposure pattern. Later, when you compare the exposure pattern, you'll be getting what ratio? Odds ratio. Yes, very good. Odds ratio. So comparing the exposure pattern and checking the odds ratio. That is what is very important. That is what is very, very important. So the question when they mention history of exposure was taken in deceased and non-deceased individuals. The exposure pattern was compared between two groups, cases and controls. Then we are calculating risk ratio. That is odds ratio. Yes, then we are calculating odds ratio. That study becomes case control study. Now tell me, if I start now 2024, if I go towards 2048 in the future, if I am staying with the individuals, what is that study? Tell me good. Starting in 2024, 2048, I'll be calculating risk ratio. What is this study? Prospective cohort study. Good. If I start from 2000, checking the records, coming to 2024, means using records, I'll be calculating risk ratio only. What is that study? Using existing records, I'll be calculating risk ratio only. What is this study? Retrospective cohort study. Good. Retrospective cohort study. But case control study is totally different. You are comparing between two groups at a time. There is no follow-up as such. You take cases, you take controls, you check exposure pattern, and you calculate odds ratio. The words will be totally different. This study is case control study. This study is case control study. Good. What is one more name for case control study? It is retrospective study. Very good. It is retrospective study. Retrospective cohort is different. The retrospective study is different. If they mention the retrospective study, then it is very basic case control study. So usually the words will be there like records, risk and all. If those two words come, usually the answer is retrospective cohort study, like what we have given to you. Cross section is very simple. At a time, if you are doing and calculating prevalence, that is cross sectional study. See the next question. Which of the following is the best parameter for assessing health status of a community? Indicator telling how good you are utilizing our services and all. If this word is mentioned, sensitive indicator for availability, utilization, health status and all. This is the exact lines taken from which book? ARC textbook. There is no other answer for this other than this. Listen to the words properly. There is no other answer. The only answer for this question will be this line is taken directly from PARC. So they repeatedly ask this question. Your answer should be infant mortality rate. Don't mark maternal mortality ratio, will be wrong. This is the question which has been repeated in the exam usually. So they're asking this question repeatedly and it is infant mortality rate. In healthcare, Colombo plan was focused on. It is very old plan. It's very old question. Around 1950s, the Colombo plan was planned. Different countries are involved in this. So they won't ask this question again. So don't worry. But if you know, it is good. It is very long back. There was a plan, Colombo plan, where all the countries are contributing together. Yes, they will contribute for health also. So in health sector, because we are doctors, the question was in healthcare, the Colombo plan was focused on. So what was Colombo plan related to? It was donating or giving cobalt therapy units for AIMS hospitals. Initially, it will help in radiotherapy. So the Colombo plan providing cobalt therapy units. C for Colombo plan, C for cobalt therapy units. Who provided CTUs? If they ask who gave this, again one more C. The government of Canada. There are different countries in the plan. They help in development of different sectors. In health sectors, the Colombo plan, the government of Canada was distributing cobalt therapy units to hospitals in our country. So this is related to CTUs, cobalt therapy units. Potential years of life lost. See the words properly. Potential years of life lost. If they ask years of potential life lost or years of life lost, years of potential life lost or years of life lost, this is due to. So tell me the answer. You know the answer. Years of life lost due to premature death. This will be the correct answer. Years of life lost due to premature death. So this indicator is used in which calculation? Tell me. This indicator is used in YLL is used in what calculation? Daly's calculation. Very good. Disability adjusted life years. Disability adjusted life years. So Daly's disability adjusted life years will indicate burden of disease. It will indicate burden of disease. For example, if I want to know burden of road traffic injuries, example I'm telling, burden of road traffic injuries. If there is an individual because of road traffic accident, there is loss of foot. I'm telling loss of foot. The patient is living for 20 years with disability. That will become years lived with disability. Patient is living with 20 years lived with disability. So the patient died, could not attain that limit. That limit is called as standard life expectancy. So from which country we take standard life expectancy? Japan. So the patient could not attain that limit, standard life expectancy. So what will happen? Whatever the years he has lost is called as years of life lost due to death or premature death. What is your answer? Now you will correct the answer. Now you know the correct answer. Tell me, it is due to death or premature death. So what is your answer? Years of life lost due to death or premature death? Premature death, because he could not attain the life expectancy. Patient could not reach that limit because that was the standard limit, which is from Japan. So standard life expectancy is used for calculating YLL. Don't make mistake, it is not national life expectancy, it is standard life expectancy we take from Japan. Japanese life expectancy is taken as standard. So we are adding two things, YLD plus YLL. That is dailies for this individual. Dailies lost in this individual. Like this we count for different individuals. The amount of dailies lost. Dailies is equal to YLL plus YLD. Years of life lost plus years lived with disability. YLL plus YLD. For this individual, this will be the pattern. For one more individual, the pattern can be different. Then we count the overall burden of this disease. Then we compare two disease which is having more burden. For example, I am telling there are two diseases. There are two diseases, X and Y. Because of X, 80 dailies lost. Because of Y, 20 dailies lost. See the words properly. Because of X, 80 dailies lost. Because of Y, 20 dailies lost. If I am asking questions like this, which is having more burden comparatively? Answer my question. Which is having more burden comparatively, 80 or 20? So what is your answer? Comparing burden of two diseases, if they mention this question to you, 80 versus 20, they give questions like this, 80 dailies lost, 20 dailies lost. So yes, good. Which is having more burden? Which is having more burden? disease X compared to disease Y. More the daily is lost, more the daily is lost, more the burden. Yes, good. So if they ask burden of disease, see my words properly. Comparing burden of disease, your answer should be dailies lost. If they ask how good is the intervention, effectiveness of any intervention, so out of dailies and qualis, your answer should be qualis gained. The intervention which is giving more qualis is better. Qualis gained by the intervention. If they ask which is an indicator as of now for overall health status of the population, overall positive health of population, then your answer should be health adjusted life expectancy. Health adjusted life expectancy. So when we have to choose what, if the keywords comes in between three things, you make mistake. If I am asking how good is the country, overall positive health levels of the country, if they ask such question, your answer should be hail, very good. Effectiveness of intervention, qualis gained, and burden of disease, dailies lost. This is the way you should search for the keywords in the question. You should always search for the keywords. So एक बार keyword match हो गया ना, so examiner फिर आपका भी frequency match हो जाता है ना, फिर सब सही है. So frequency match होना बहुत important होता है ना लाइफ में. Underline this word, progressive spastic paralysis. Progressive spastic paralysis. Lower limb weakness, fine. Financial means poverty. So if this is the question, spasticity. So very easy question. What we have discussed. It is due to which toxin? Boa. So kesar dal consumption, na? Kesar dal consumption. Very easy question. Lathyrus sativus. Lathyrus sativus. So S for sativus, S for spasticity. Remember like this. Spastic paralysis. The toxin will be boa. So how the stages, how the disease will present with different stages will be knowing. No stick, one stick, two stick and crawlers. So they will be needing crawlers to move from place to place. Because of scissoring gait, they cannot move from place to place. No stick, one stick, two stick and crawlers. At last, they need crawlers to move from place to place. So what vitamin can be used for prophylaxis? You can remember the word C for crawling, C for vitamin C. Vitamin C will help in prevention. Like it is primary level of prevention, it is prophylactic measure which can be used for preventing neurolatherism. How neurolatherism presents? If they ask, it is spasticity. It is spasticity. So the answer is neurolatherism. Neurolatherism. They will mention the patient will be having weakness, one stick, two stick. They'll be giving the history if they give, na? Or else they will give the question like this: spasticity, spastic paralysis. So S for sativus, S for spasticity. Remember the words kesar dal. Good. So 1 vial of pentavalent vaccine and 2 vials of MR vaccine is coming back to the clinic. So they are opened, provided that everything is fine, date and time is mentioned, cold chain is proper. Which of them will be used and which will be discarding? So again, it is as per open vial policy, na? It is as per open vial policy. So what is your answer? Yes, good. Use pentavalent and discard MR. Use pentavalent vaccine and you can discard MR vaccine. Open vial policy, as of now, what is the thing you should know? Any vial which is opened, you can use within 28 days. You can use within 28 days. So date and time should be mentioned. Date and time should be mentioned. Open vial policy means you can use it in the next session. It is not applicable for. It is not applicable for. So remember British Medical Journal, BCG, measles are MR, Japanese encephalitis live because it is diluted. So you see the words properly what I am using. Not applicable for BCG, measles or MR and Japanese encephalitis live. It is applicable for. It is applicable for. So write down Rotavac. Now it is applicable. JE killed, it is applicable because some states they have started using JE killed also. So should be knowing JE killed, it can be used in the next session. It is liquid. Rotavac, because of multi-dose vials, you can use it in the next session. And any other vials, no need to write anything else. Anything other than this. TT, hepatitis B, OPV, IPV, PCV like that. It is applicable. So now tell me, Rotavac, it is applicable or not? See the words properly. Rotavac, I am telling. Rotavac, it is applicable or not? See the words properly. Yes, sir, it is applicable. You can use it in the next session. JE killed. Is it applicable or not? Yes, sir, it is applicable. You can use it in the next session. JE live, you cannot use it because it is diluted with phosphate buffer saline. So these are the things. Other than this, COVID and all those schedule case आपसे नहीं है ना. COVID it is not applicable. Rabies it is not applicable because it is diluted. And even yellow fever it is not applicable because it is diluted. So anything which you dilute it is not applicable. Why I am not stressing COVID, rabies and yellow fever? Because that is not a part of national schedule. They are dealing with different diseases. COVID not applicable, rabies not applicable, yellow fever not applicable. So this is the thing as of now. Open vial policy. So if possible, try to make a note of it. Good. See the next question. See the next question. See the next question. Applied nutrition program. So this concept of applied nutrition program, na? So it is promoting school gardens. Remember this. It is promoting school gardens. So within school they will be growing their own vegetables, fruits. So school gardens, the seeds and manures for school health services under applied nutrition program. The funding was given by UNICEF. The funding was given by UNICEF. So if they mention seeds and manures, अगर एक word directly दे दिया ना, then your answer should be UNICEF. So applied nutrition program, it is for sustainability. So the schools, especially yes, they have started from African countries. In India also, Bihar, UP, some part of Southeast Asian countries. Yes, we have started this concept of applied nutrition program, seeds and manures. So it is given by UNICEF. It is given by UNICEF. Asha worker is motivating women in urban area of Madhya Pradesh. Women in urban area of Madhya Pradesh. So what is this scheme called as? Yes, good. Janani Suraksha Yojana. Janani Suraksha Yojana. What they want you to know is whether this Madhya Pradesh is low performing state or high performing state. That is what they wanted to know. That's it. Whether Madhya Pradesh is low performing state or high performing state. So Janani Suraksha Yojana is giving cash incentives for pregnants and ASHA workers. For pregnants and ASHA workers. So low performing states, all the pregnants will be given incentives. Low performing state, all the pregnants will be given incentives. High performing state, below poverty line, BPL pregnants will be given incentives. BPL pregnant will be given incentives. So if the question comes, as of now it is irrespective of two things. Irrespective of age and irrespective of parity. Cash is given irrespective of age and parity. So remember these 2 points, age and parity. So what are the low performing states? What you know? Tell me important low performing states, what you know? You can remember like this very easily. Yes. UP, Uttarakhand, MP, Chhattisgarh, UP, Uttarakhंड, MP, छत्तीसगढ़, बिहार, झारखंड, जो पहले साथ साथ थे ना, now it is different states. You can remember like this: UP, Uttarakhand, MP, Chhattisgarh, Bihar, Jharkhand, and the remaining 4 mnemonic will be Roja, Rajasthan, Odisha, Jammu Kashmir, and Assam. Roja, na. Total 10 low performing states. Total 10 low performing states. You can remember like this: UP, Uttarakhand was together, MP, Chhattisgarh was together, Bihar, Jharkhand was together. The last is the mnemonic, Roja. Yeah, Rahman, na? Roja. It's good, looking good. Yes, MP. The question was on MP, na? Madhya Pradesh, urban area. यहाँ पे देखो, rural area, urban area, rural area, urban area. Mother Asha, Mother Asha. So low performing state, urban area. 1000 rupees for mother, 400 rupees for Asha worker. 1000 rupees for mother, 400 rupees for Asha worker. If I ask Uttar Pradesh rural area, then what is your answer? If I ask Uttar Pradesh rural area, then what is your answer? Uttar Pradesh rural area, what is your answer? Good. 1400, 600. 1400, 600. They are promoting more of rural areas. They are promoting incentives more in rural areas comparatively, because they want more deliveries from rural areas. They want to increase hospital deliveries from rural areas. Yes, good. They want to increase hospital deliveries from rural areas. Keep the table. So no need to worry about what if Asha becomes pregnant and all that. Question won't come. Like students will be asking, sir, what if Asha becomes pregnant? इतना तक नहीं सोचेंगे एग्जामिनर ना. अब सुनो, green tea and diabetes mellitus, exposure and outcome. Exposure and outcome. Cohort study was undertaken. So to study the risk, cohort study was undertaken. Cohort study was undertaken. So the green tea was the exposure, diabetes was the outcome. The risk ratio is 0.85. They are just giving the point estimate for you. Confidence estimate is not mentioned in the question. The question becomes very easy. They are not commenting on the significance also. Just point estimate is given. Risk ratio is less than 1. So there is less risk. It will reduce the risk. The question is not commenting on significance. So nothing to worry about p-value, nothing to worry about confidence estimate, just basic level of question. If risk ratio is more than 1, positive association, there is increased risk. Risk ratio less than 1, negative association, there is decreased risk, and risk ratio is 1. If risk ratio is 1, there is no association. Risk ratio is 1. If they are asking, then there is no association. So got my point? Good. Option B is the answer. Option B is the answer. The patient is on tuberculosis treatment. See the next question. The patient is on tuberculosis treatment. So sputum examination is done. Sputum examination is done after intensive phase and continuation phase. So patient will be taking treatment for how many months? 6 months. Intensive phase 2 months, continuation phase 4 months. So the patient sputum examination was done after intensive phase and continuation phase. Both are negative. Both the samples are negative. This is the question. Both the samples are negative. So usually what will happen in the outcome, You should know the difference between cure and completed. Usually we ask question like this. If both the samples are negative, it is treatment के बाद भी अगर negative है, intensive phase results are negative, treatment completion के बाद भी negative है, then it is cure. Then it is cure. So if it is completed, if I am asking this word treatment completed, when you can tell that the treatment completed, how you can take the results? Intensive phase negative, after continuation phase the sample results are not available. The sample results are not available. If this is the word given, then it is treatment completed. So failure, follow up and all not necessary now. We are not using the words like relapse, failure as such. So for drug sensitive tuberculosis, remember two words, cure and completed. Let's keep it simple, cure and completed. So both the samples are negative. Both the samples are negative. Then the answer is treatment cure. Then the answer is treatment cure. Lifespan of Japanese women is 84.3 years. Okay, that is the highest life expectancy. They have the longest life expectancy. So we are using this for measuring disease burden. I think we have discussed this question indirectly. Already we have discussed this question indirectly. They have the highest life expectancy. They have the highest life expectancy. So we are using that as the standard life expectancy. Yes, good. Standard life expectancy. See my words properly. Standard life expectancy. That is used in calculation of YLL or YLD. First answer my question. Already question indirectly discussed हो चुका है. Tell me good. Where I discussed standard life expectancy is used in standard life expectancy is used to calculate YLL or YLD. YLL, it is used for calculating YLL. Yes, YLL. What is YLL? Years of life lost due to premature death. Years of life lost due to premature death. Yes, good. Don't make mistake. Very basic question I'm asking. Years of life lost due to premature death. Means what is the limit? Standard life expectancy. Which country we take standard life expectancy? From Japan. So that is used in calculation of dailies. That is used in calculation of dailies. What is the formula for dailies? Yes, good. YLL plus YLD. YLL plus YLD. YLL plus YLD. So when you are adding these two things, you will be calculating dailies lost due to a disease. Dailies lost due to a disease. Yes, correct. Dailies lost due to a disease. Which of the following is the most logical and cost-effective approach for rabies control in urban areas? Again, the question is directly from Park. So the lines directly from Park. So what is your answer? Yes, correct. What is your answer? Vaccination. Yes, mass vaccination and eliminate stray dogs. Mass vaccination and eliminate stray dogs. Highlight this word. Mass vaccination and eliminate stray dogs. So there is one more thing which is very, very important. 0 by 30 initiative, that is also related to rabies. 0 by 30 initiative, that is also related to rabies. What is 0 by 30 if they ask? It is to achieve 0 deaths. Nobody should die due to rabies. 0 deaths by the year 2030. This is WHO initiative. Yes, good. This is the initiative of WHO. They want to achieve 0 mortality for rabies by which year? Answer my next question. Very good. 0 mortality by which year? 0 by 30, 0 by 30. It is 0 mortality, 0 deaths by the year 2030. By the year 2030, this is WHO initiative. We'll ask this question, 0 by 30, 0 mortality. So what is the best way of eliminating rabies, especially or controlling urban rabies? If they mention questions like that, then your answer should be this: remove the stray dogs and mass vaccination of dog population. Mass vaccination of dog population. Very good. So crush injury, road traffic, blood spills. Blood spills, yes, good. Then what is the disinfectant used? So they are not mentioning like HIV patient and all. If the HIV patient is mentioned, fine. Then also the answer won't change much. Yes, good. What is the answer? We're using sodium hypochlorite solution. So we have discussed all these things in the classes. So sodium hypochlorite solution. What I say is the mnemonic midday meal, na? Midday meal means first we mop, then we use disinfectant, then again we mop it. So mop, then disinfectant, leave it for around 10 to 15 minutes. The disinfectant used is sodium hypochlorite. Sodium hypochlorite. Then again you mop it. So what is the first step we'll be doing? Apply disinfectant or mop it? What is the answer? What is the first? We have discussed all these mnemonics also. Midday meal, na? Mop, disinfect, mop. So what is the first step always? Absorbable tissue, we have to mop it. Yes, the mop will go into which bag? Tell me. Biomedical waste. Mop will go into which bag? Yellow bag. Yes, good. Mop will go into yellow bag. So remember the mnemonic: midday meal, mop, disinfect. Again you mop it. Again we throw it in yellow bag. So this is the way how you are managing blood spill. Mercury spill, they will ask short question. Either they will ask blood spill or mercury spill. That is what I have discussed in the classes also. Mercury spill. There are two things. Very easy question. They'll repeat this. I'm asking bedside practice. Broken glass will be there. The second thing is mercury will be there. One is broken glass and mercury. Broken glass will go into blue bag. Broken glass will go into blue bag, and mercury will be collecting using X-ray sheets or cardboard sheets. X-ray or cardboard sheets, and you will be disposing it into a glass of water. Later they will recycle it. At bedside will be disposing into a glass of water. This is how you collect. Yes, good. Very good. Cardboard and water. Very good. So broken glass will go into blue bag. Broken glass will go into blue bag. This is how you manage bedside, na? Agar blood spill ho gaya, mercury spill. See the words. Height for each less than 2 standard deviation means that score is less than 2 standard deviation. So what it will indicate? So Anganwadi worker is taking the anthropometric measurements. Height for each is less than 2 standard deviation. So what it will indicate? So what is your answer? Very good. Stunting. It is going in favor of chronic malnutrition. So stunting, wasting, stunting, wasting and underweight. Stunting, wasting and underweight. Stunting is height for age. Stunting is height for age, indicating chronic malnutrition. Chronic malnutrition. Good. What is wasting? Weight for height. Weight for height, indicating acute malnutrition. Acute malnutrition. Underweight is weight for age. Both acute and chronic malnutrition. Both acute and chronic malnutrition. So if they ask Anganwadi centers. When you go to Anganwadi centers, when they plot growth charts in Anganwadi centers, na, blue chart for boys, pink chart for girls, what they are plotting? In Anganwadi centers, what they are plotting? If they ask, what is your answer? Very good. In Anganwadi centers, we plot weight for age. In Anganwadi centers, we plot weight for age. It will indicate both acute and chronic malnourishment. Acute and chronic malnourishment. One more question on stunting. What you should know is, what is mission 25 by 22? What is your answer? One more question which is important for me. What is mission 25 by 22? So good. If I am using the words mission 25 by 22. Mission 25 by 22. It is one of the target under what? It is one of the target which was supposed to be achieved under Poshan Abhiyan, National Nutrition Mission ना, पोषण अभियान के अंदर एक टारगेट था ये वाला ना, मिशन 25 by 22. Yes, good. Mission 25 by 22. To achieve the prevalence of stunting, should come down to 25%. Should come down to 25% by the year 2022. The prevalence of stunting should come down to 25% by the year 2022. This is Mission 25 by 22 under Poshan Abhiyan related to stunting. The prevalence should become 25% by the year 2022. This was the target which is important for us. Target kept in Poshan Abhiyan related to stunting. This is called as Mission 25 by 22. So this is Poshan Abhiyan, not Poshan scheme. Poshan is different. That is midday meal. Na? This is Poshan Abhiyan. Poshan Abhiyan alag hai, Poshan alag hai. Pradhan Mantri Poshan na. That is midday meal scheme. One more name for midday meal scheme is Pradhan Mantri Poshan. So the air quality values are given 24th November. If the values are more than 400, the values of air quality index is more than 400. Usually we ask this question. In between, if I am asking, it will become very difficult. Usually we ask question, the values more than 400, it is under severe category. It is under severe category. So it is based on air quality index. Air pollution index is different. We don't ask question because we don't monitor air pollution index in our country. It is more of air quality index what we check. Na? So if it is more than 400, it is severe. Low air velocity is measured by. So what is the instrument? They are fond of this instrument. Usually they will be asking anemometer and kata thermometer. The answer for this question will be kata thermometer. Initially it was used for cooling power of the air. Initially it was used for cooling power of the air. Now it is used for air velocity. Now it is used for low air velocity. If I am asking one more question, which is that one more instrument which can be used for air velocity? What is your answer? Which is that one more instrument which is used for air velocity? Anemometers. We have 4 metallic cups, na? Anemometer. Anemometer is also used for air velocity. Globe thermometer. The difference what we take, there is one thermometer inside and the outside. Na? Within the globe there is one thermometer. Outside here there is one thermometer. Globe thermometer, when you take the difference, it will indicate radiant heat. X minus Y, what you do? Globe thermometers will indicate radiant heat. Highlight this word. Globe thermometers will indicate radiant heat. Silver thermometer, wet globe thermometer, there is not necessary. There is not a single question. It is not mentioned in the textbooks also. So it is just fill in options, so nothing to worry. Globe thermometer is for radiant heat. So SI unit for brightness of light. So optics question. So physics 12th standard. You might have come across all this question. So physics, this level of physics is there in Park textbook. So they're asking questions. So it is not your mistake also. It is not the textbook mistake also. They want you to know, fine. But it is very difficult to remember all these small things. That is also fine. Everything is fine. There is nothing to worry. If the question comes, if you know this table, you will get a correct answer. If the question comes, if you know this table, you will get a correct answer. So brightness of point source. So when the candle is, remember like this, when the candle is burning now, the brightness of point source, when the candle is burning, so that is where light starts. So candle, na, that is very important. So it is candela. The unit is candela. So what is your checking? It is the intensity, how it is. The brightness is measured and we call the word as intensity. How intensive burning is. You remember like that. That is where the point source it is burning. Then the flow of light. Flow, flux, that is lumen. You can see there is one lumen like this where the light will flow. Remember like this. There is one candle which is burning, then the light will flow. So if they ask SI unit of flow of light, then your answer is lumen. Then your answer is lumen. The amount of light reaching the surface. So if it is touching you, remember like this, illumination or illuminance. When you're using Lux soap, na? When you're using Lux soap, very old soap, I might have not come across. Even in my childhood days, I can remember I have used Lux soap. Small soap we used to have, like if you go to a cricket match, in between my mother, like she used to keep that Lux soap. I can remember that. And I was like, that brightness, na, glowing Lux, amount of light reaching the surface, it is Lux. Yes, good. When the light reaches the surface, when it is touching me, then I'll be glowing like white, na? Cute. Underline this word. The amount of light re-emitted from the surface, Lambert. It's very difficult to recall. So I'm making some stories or whatever you can tell. So candela, lumen, lux, and Lambert. So illuminance is different, luminance is different. So remember like this. This question can be repeated in the exam. Yes, sir. This table can be repeated. This can be asked in the exam. So the question was on the initial thing. If I'm telling 1, 2, 3, 4, 1, 2, 3, 4, the question was on 1. So the SI unit of brightness of light. The SI unit of brightness of light. The answer is candela. See the next question. Pharyngitis. The swab was taken. So the body fluid, na? The swab was taken. Where will be disposing this swab? That is a question. Where will be disposing this swab? So pharyngitis, swab, like the culture, anything which is body fluids, like you are exposing it to, na, it is infective already. So easy question. The answer is yellow bag. Answer is yellow bag. So the swabs, yes, something which is infective. So remember, like yellow, there is not a big thing to recall in the exam. What they're asking is the anatomical waste usually. Generally, I'm telling the anatomical waste, human anatomical waste like fetus, dead, placenta, or animal anatomical waste. Then remember the infective fluids like swab which is contaminated. Let me take the word C. C for contaminated with blood and body fluids. Contaminated with blood and body fluids. Cotton, cloth, which is, I'm telling cotton and cloth which is infected, contaminated with blood and body fluids. Then comes anything which is cytotoxic. Anything which is cytotoxic. Cytotoxic waste. Chemical liquid. Chemical liquid. Mask. Blood bags is very easy. Anything I told already, I've told blood and body fluid, so blood bags. So remember mainly these things. ECC cement, what I say, anatomical waste, contaminated, cytotoxic, chemical liquid, blood bags and mask. So what you'll be doing, you'll be remembering each and everything in biomedical waste. Later when they ask easy question, either you'll mark yellow or you'll mark red. So you'll be playing Anchani mentioning that in between that you'll be marking. So remember the main things, and if the examiner is asking these things, mark it correctly. So finish the game properly. Leg side ball, leg side, offside ball, offside, but blood bags are discarded. So both the questions, if they frame the question, they will ask chemical, liquid, cytotoxic, all these questions if they are asking. Contaminated or anatomical waste, mask, blood bag. So all this will go in which bag? Yellow bag. Yellow bag. If I am asking TRP, just I am telling tube, rubber, plastics. TRP. Rating है ना? If I am asking tube, rubber, plastics, where it will go? Tell me good. Tube, rubber, plastics, where it will go? Tube, rubber, plastic, where it will go? Anything, gloves, contaminated also, nothing to worry. If it is gloves, it is red. Contaminated or uncontaminated. Tube, rubber, plastics, it will go in red color. Yes, good. It will go in red color. Extended sickness benefit under ESI Act. Sickness benefit is different. That is for 91 days. My question is extended sickness benefit. Then it is 2 years. So sickness benefit is for 91 days. Extended sickness benefit is for 2 years. So it will cover 34 diseases. It will cover 34 diseases. Right, that's the word. It will cover 34 diseases. The patient is on MDR TB treatment. If I am asking question like this, the patient is on treatment for MDR TB. Around 18 months of treatment, for example, the patient will get what benefit under ESI? If they ask this question, it is extended sickness benefit. Extended sickness benefit. If the female wants to undergo tubectomy, the female wants to undergo tubectomy, yes, then you will get what benefit under ESI scheme? Tell me the word. Exact word I want. If the patient wants to undergo tubectomies, the patient will get what? Enhanced sickness benefit. See the words properly. Enhanced sickness benefit. It is for sterilization purpose. It is for sterilization. How many days for male? 7 days. How many days for females? 14 days. F for female, F for 14. So for vasectomy it is 7 days. For tubectomies it is 14 days. Full wages. They won't deduct anything. It is full wage under enhanced sickness benefit. F for female, F for 14. For males थोड़ा सा कम देते हैं, ठीक है. 7 days, fine. We'll take it. Underline this word. The undergo vasectomy 7 days. For females it is 14 days. Full sterilization, enhanced sickness benefit. Sustainable development goal. See the words properly. The next question is on SDG. Sustainable development goal. So as per sustainable development goals, the target for maternal mortality ratio, the target to be achieved under maternal mortality ratio. So what is your answer? The limit what they are asking. The limit what they are asking. So always remember 3 words: maternal mortality ratio, neonatal mortality rate, and under 5 mortality rate. Maternal mortality ratio should be less than 70 per 1 lakh live births. Less than 70 per 1 lakh live births. Neonatal mortality rate should be 12 per 1000 live births. Under 5 mortality rate should be 25 per 1000 live births. Highlight this word. Answer is option A. Don't make mistake in these three numbers: neonatal mortality rate, MMR, and under 5 mortality rate. MMR should be less than 70 per 1 lakh live births. Neonatal mortality rate should be 12. Under 5 mortality rate should be 25. Under 5 mortality rate should be 25. See the question. Next question is, the variation in one sample can be compared with the variation in another sample. See the question properly. The variation in one sample can be compared with the variation in another sample. Tell me, what is this? You have exact word in the notes. When you want to compare variation between two samples, compare variation of data between two samples. Compare variation of data between two samples. So what is your answer? It should be a unit less dimension. It should be a unit less dimension. It should always be a unit less dimension. So what is your answer? Coefficient of variation. Remember the words properly. Coefficient of variation. What is the formula for coefficient of variation? Standard deviation by mean into 100. Very good. Standard deviation by mean into 100. If at all they frame this question, listen. Height I want to check between males and females. Height if I want to check between males and females. Height if I want to check between males and females. So see the words properly. One side we have males, the other side we have females. One side they are giving in inch, 160 inch mean. Standard deviation is 16 inch. See the words properly. Standard deviation is 16 inch. But for females, okay, 150. Again I am telling in 1500 centimeter, 150 centimeter. Okay, deviation is 150 centimeter. Now tell the amount of variation is equal, because coefficient of variation when I am calculating, the variation is equal. You can tell whether it is equal, you can tell whether it is more, or you can tell whether it is less, even though the units are different. See the relationship in between them. 16, 160. Coefficient of variation is how much percent? 10%. The other side again you can tell it is 10%. The relationship you can check. But still, even though the units are different, you can tell whether it is more, less, or same using one parameter. This will be the question. What is that parameter which is not having any unit, which is a unitless dimension? So what is your answer? Coefficient of variation. What is the answer? Coefficient of variation. So always remember the words. Coefficient of variation is always used to compare variation of one variable between two samples or between two variables within one sample. If I want to compare pulse and blood pressure of athletes, if I want to compare whether pulse is varying more or blood pressure is varying more between two variables within a group of athletes, cricketers for example, what can be used to compare the variation? This question is very important. Between two variables within one group, if I am asking, then what is your answer? C for comparison. When the word C comes, C for comparison, C for coefficient of variation. Keep this question in mind because it is more practical stats what they are asking nowadays. Calculation part is very rarely asked. What they will ask is application, where you need to apply it clinically. The difference between incidence in exposed minus incidence in non-exposed. Okay. What is the answer? What is the answer? Tell me good. What is the answer? I think we have discussed both the formulas in the class notes. There is one more formula for this. Both the formulas we have discussed. It is attributable risk, also called as risk difference. attributable risk, also called as risk difference. There are two formulas for attributable risk. This formula can also be used. You can express it in whole number. So what are the three things you can calculate from cohort study? Tell me. Good. What are the three things you can calculate from cohort study? Analysis, I'm telling. What is a mnemonic? Wrapping. Wrap. Risk ratio. Attributable risk. Very good. Attributable risk. The third is population attributable risk. Population attributable risk. Population attributable risk. The formula for risk ratio is dividing two things. Ratio na incidence in exposed divided by incidence in non-exposed. Attributable risk means you can use two formulas. Either you can use risk difference, you can subtract two things. Or you can use this formula where you want to express it in percentage. Attributable risk in proportion. Incidence in exposed minus non-exposed by expose the whole thing into 100. If I want to express it in proportion, then you can use this formula also. But in place of exposed group, if I change, in place of exposed group, if I can put incidence in total population. In place of exposed group, if I can put incidence in total population, then your formula will change. Incidence in total population minus incidence in non-exposed divided by incidence in total population. This is the formula for population attributable risk. This is the formula for population attributable risk. So if I want to check how much advantage I can give for the whole population, if I can eliminate that risk factor, that is population attributable risk. How much the advantage I can give only for exposed group. If I can remove that risk factor, that is attributable risk. So comparatively, which is more important for public health? If I want to arrange in sequence, comparatively, which is more important? Obviously, population attributable risk will be more important, because it is telling how much advantage a population can get if I can remove that risk factor. So this is the most important thing. So remember the mnemonic. Risk ratio is just the strength of association. There is no preventive component in that. Attributable risk can tell how much you can prevent, the amount of disease which can be prevented in the exposed group only. But for the whole population, we are using this word population attributable risk. Population attributable risk. So this question where the outcome is measured in monetary terms. So indirectly, this is the short question what they have sent. So the outcome is measured in monetary terms. So what is this? The outcome is measured in monetary terms. It is cost benefit analysis. The input output. Output is measured in monetary terms. The benefit what you are checking it is in monetary terms. It is cost benefit analysis. Cost benefit analysis. If the output is in results, number of deaths prevented, number of children vaccinated, number of deaths prevented, number of children vaccinated. What is that? Cost effectiveness analysis. If I am telling for every 10 rupees invested, how much deaths you can prevent, results what you are checking, then it is cost effective analysis. For 10 rupees, if I get 20 rupees, then it is cost benefit analysis. Network analysis, you can tell the way how the events will go, sequence of events. Network analysis to assess the sequence of activities. We'll be making an arrow diagram. For example, PERT, program evaluation and review technique, is a type of network analysis, correct? Program evaluation and review technique. It's a type of network analysis, correct? PPBS, na program budgeting system. It is one of the way of doing budget. They won't ask that question. For you, it is more of network analysis. If I am asking sequence of activities, arrow diagram, then it is PERT, program evaluation and review technique. It is a type of network analysis. Cost benefit analysis, cost effectiveness analysis. थोड़ा सा easy question है, where the output is different. Output is money, then it is cost benefit. Output is results, then it is cost effectiveness analysis. Cost effectiveness analysis. If one variable is given, you can find the another variable. Actually, the question is fine. There is an answer for this. Thoda sa incomplete question hai, but still I will take this question like this only. Yes, then what is the answer? If one variable is given, you have to predict how much the other variable will change. If I increase my salt intake, by 1 gram, if I increase my salt intake by 1 gram, yes, good. How much the another variable will change? So exact word is there. Don't make mistake in this question. It is regression. It is regression. Y is equal to A plus B x. Y is equal to A plus B x. Y is dependent variable. X is independent variable. X is independent variable. A is constant. The intercept. B is regression coefficient. B is regression coefficient. So if I am taking the same example which I give in the class, like for example easy, systolic blood pressure, salt intake. After checking for correlation, when there is correlation, that is positive relationship, increase in salt intake will increase systolic blood pressure. After correlation, the next thing what you do is regression. See the words properly. After checking for correlation, we do regression. What type of correlation will be saying? Tell me good. Salt intake and systolic blood pressure. What type of correlation will be saying? Will be saying positive correlation. दोनों के बीच में ना अगर salt intake is increasing, systolic blood pressure will also increase. You'll be seeing positive correlation. But the next thing what you should do is regression. So the next thing what you should do is regression. So if I am telling this word, for example, E is constant if it is 10, B is regression coefficient 2. After doing regression, we got these two values. Constant 10, regression coefficient is 2. Now answer my question. If I increase the salt intake by 1 gram, see this question properly. If I increase the salt intake by 1 gram, how much my systolic blood pressure will change? That you can easily predict. This is the question. Predicting the amount of change in Y with respect to X. Predicting the amount of change in Y with respect to X. If I increase the salt intake by 1 gram, you can substitute the value 1 year. How much my Y will change? This will be the question. How much my Y will change? So 12 millimeter of mercury. इतना फर्क पड़ेगा ना? So you can counsel the patient like आपका salt intake by 1 gram. If you can increase, your BP can change by. This is the use of regression to predict the amount of change in Y with respect to X. So to predict the amount of change in Y with respect to X. That is a use of regression. Very important. Very, very important question. Prospective screening. See this word. Prospective screening. Or you can take it as odd man out. So prospective screening is done in case of which? So prospective screening and prescriptive screening. What is the main purpose? What is the main difference? What I discuss in the classes. What is the main difference actually? How to differentiate the words? How to differentiate the words? Prescriptive screening, yes, and prospective screening. Prescriptive screening is usually for non-communicable diseases where the patient will have benefits. It is mainly for own benefit. Prospective means we think ahead, and next level of thinking we'll be doing. Prospective is for communicable diseases, very good, where others will get benefit. Others benefit. So which is used for detection. So iska matlab the main purpose is detection, where you detect non-communicable disease like cancer, etc. I'm telling. Detection is for prescriptive screening. Yes, very good. So disease control, if I want to check, then it is prospective screening. Disease control, if I want to check, then it is prospective screening. So now tell, out of the available options to you, out of the given options to you, which is an example of prospective screening? Which is an example for prospective screening? Yes, good. Immigrant screening, that will be the answer. बाकी सब देखो, thyroid, pap smear, diabetes, all these are example for prescriptive screening. So immigrants, if I am screening for any disease, it will go under what? Prescriptive screening. Immigrant is prospective, बाकी सब prescriptive है. Write this word. Immigrants, it is prospective. बाकी सब जितने भी होगा, that is prescriptive. Now tell the question. If I screen COVID in travelers, what type of screening? If I screen COVID in travelers, what type of screening? COVID in travelers, what type of screening? Prospective screening. Okay, good. See the next question. What is your answer? Just check one. What I am telling is just checking the relationship. Okay, they're checking the relationship. That is a keyword what I am taking from the question. Records both the sides. For COPD from hospital, for cigarette sales they are checking from finance department. So whatever the sales which has happened. So it is an example for what study? Why it is ecological study? Answer is ecological study. But why it is ecological study? What is one more name for ecological study? Correlational study. Yes, very good. One more name for ecological study is correlational study. Yes, you'll be checking the correlation between two variables. Cigarette sales, how much it happened, and COPD cases. Cigarette sales in the city and COPD cases. They are taking, yes, good. It's more of, yes, what is the unit of analysis? This is what I want. Not secondary data as such. I want the unit of analysis. The unit of analysis will be at population level or group level. Doing correlation by checking the data at group level. This is very important. Two words should be there. Correlation and doing the study at group level. See the words government hospitals, taxation. So they are checking the correlation. Cigarette sales, if it is increasing, COPD cases will also increase. City wise, if you can check, area wise also you can do. Positive correlation you can see. Very good. You should have this word, unit of analysis. The second word, what is important is correlation, what you'll be checking. So if you can see cigarette sales in the city and the number of COPD cases admitted in that city, Pune, Mumbai, Delhi, Bangalore, like that you can take Kolkata, RCB or whatever. So if you can go city wise, I'm telling, unit of analysis, population or group. The second thing what we're checking is the correlation part. So it is ecological study. You can be saying yes. Positive correlation. Positive correlation. The study was done to assess malnourishment among young children. 100 in the total children, like 30 are malnourished in this area, 20 are malnourished in the other area. If they are giving like this, malnourishment proportions they are giving. Malnourishment proportions they are comparing. Yes, good. Scatter plot, fallacy, everything you know. Very good. Now tell proportions you are comparing between two groups. Proportions you will be comparing between two groups. Then what is your answer? Proportions will be comparing between two groups. Answer should be chi-square test. Yes, good. When you are comparing the outcome as proportions, two or more than two groups, then you can use chi-square test. Proportions, you should remember two tests. One is two or more than two groups. You will be using chi-square test. Very good. You will be using chi-square test. If I am telling proportions, one group before after intervention, before after intervention. So what is your answer? Proportions, if you compare one group, if you are checking before after intervention, before it was 80%, after intervention it is 20%. Like if I am telling the proportion of obesity was 80% in a group, after lifestyle modification the proportion of obesity is just 10%. पहले 80% है, बाद में 10% हो गया, बीच में इंटरवेंशन डालोगे ना. What is the answer? Proportions I am asking. Yes, good. McNamara test. Don't mark paired t test for everything. कुछ भी पूछेंगे तो आपका आंसर पेड टी टेस्ट ही रहेगा. पता नहीं, बार बार आप, वो बुलाती है लेकिन जाने का नहीं, उधर क्या बोलते हैं, बुलाती है जाने का नहीं है ना. बार बार आपका आंसर पेड टी टेस्ट ही रहेगा. मैं कुछ भी पूछो. पेड टी टेस्ट कहाँ यूज होता है? हाँ, पेड टी टेस्ट कहाँ पे यूज होता है? I'll be telling later. एक क्वेश्चन आएगा, पेड टी टेस्ट अनपेड टेस्ट. पेड टी टेस्ट अलग है, अनपेड टी टेस्ट अलग है. मैक्नेमर टेस्ट है इसके लिए आंसर ना. प्रोपोर्शंस, proportions, two or more than two groups, chi-square test. One group before after it is McNamara test. Sign test and all, that is for median what you compare na. Wilcoxon sign rank and all. Later I will give one table. At last I will give one table for tests of significance. Don't worry. At last I will give one table for. I can't tell that joke in English na. So वो that joke is for हिंदी only. बुलाती है जाने का नहीं, मतलब उसको इंग्लिश में कैसे बोलो? She is calling, don't go. मजा नहीं आएगा ना. She is calling, don't go means underline the mnemonic chi-square test, McNamara test. Some jokes, if it is in Hindi, I have to tell in Hindi only na. If I tell in English, it won't look good. Underline this word, chi-square test, McNamara test. Chief Minister is the mnemonic. Tell me the mnemonic for proportions. Tell me the mnemonic for proportions. Chi-square test, McNamara test. What is the mnemonic? Chief Minister. Chief Minister. Yes, good. Chief Minister. Where you use Monica? Monica project कहाँ पे आया था? Monica. Yes, good. Monica project. Where it was? Like Monica project. Monica project is related to what? Monitoring the trends and determinants. Yes, good. Monitoring the trends and determinants. See the words Monica. Monitoring the trends and determinants for cardiovascular disease. It is WHO project. It is WHO project for monitoring the trends and determinants of cardiovascular diseases. For cardiovascular diseases. Monica. Probability of a person with positive test having disease. See the words properly. The test results are positive. The chance of having disease what you are predicting. So it is prediction. So what type of prediction you are making? Positive prediction or negative prediction? So what is the answer for this? What is the answer for this? Probability of a person with positive test having the disease. So what is the answer? test results are positive, then you are predicting whether there is chance of having disease or not. So what is the answer? Positive predictive value. Positive predictive value. Yes, very good. If I change the question, probability of a person with negative test not having disease. If I make the question ulta, probability of a person not, like if the negative test not having disease means you are ruling out. Diagnostic power of exclusion you are doing. First we did inclusion, now we are excluding it. Then it becomes negative predictive value. So diagnostic power of a test. Diagnostic power of a test. One is for inclusion, the other for exclusion. One is for inclusion, the other is for exclusion. Yes, good. For inclusion it is positive predictive value. For exclusion it is negative predictive value. Negative predictive value. If I ask a question like this, there is one screening test. There is one screening test. There is one screening test. Listen. Ability of a test to detect true positives. Then what is your answer? Ability of a test to detect true positives. Ability of a test to detect true positives. So what is your answer? Sensitivity. Okay, good. Ability of a test to detect true positives. Then it is sensitivity. See the definition I am telling. Definition is how it will come, how you have to mark the answer. That is my question. Ability of a test to detect true negatives. If this is the word. Ability of a test to detect true negatives. Then it is specificity. See the definition. Ability of a test to detect true negatives. Then it is specificity. So the definition was asked, but still if they ask how you calculate, just basic thing, what you are doing here in PPV and PV, disease present, absent, 100 deceased, 200 normal according to gold standard test. How much your test will detect? Test detected, not detected. Test detected, not detected. So out of 100, 80 are detected. This is true positives of a test. Sensitivity will be 80%. Not detected, 20. False negatives of a test. Not detected, false negatives. In the same way, the other side, out of 200, 180 true negatives, remaining 20 false positives of a test. So this is the table. This is the table. If I come like this, vertically if I track, just I am concising it based on the discussion session what we have. If I come like this, what you are getting? 80 by 100 sensitivity. Yes, good. If I catch this number and come like this, what will be getting? Specificity. That means if you go vertically, you will be getting sensitivity and specificity. Ability of a test to detect true positives. Ability of a test to detect true negatives. In case if I am going in a row mode, if I go like this, what I will be getting? 80 by 100 positive predictive value. Good. If I catch this, if I go like this, negative predictive value. Negative predictive value. So if I go in columns, it is sensitivity, specificity. If I catch the same value, if I go in rows, row 1 is positive predictive value, row 2 is negative predictive value, row 2 is negative predictive value. Yes, good, very good. Yes, vertically, horizontal. In the class also we do this magician techniques. Magicians will be doing like this, will be having one cloth, they'll be doing like this, 1 2 1 2, like that. Unka alag technique hai, PPV and PV. रोज में जाएगा ना. क्रॉस प्रोडक्ट रेशियो. व्हाट इज वन मोर नेम फॉर क्रॉस प्रोडक्ट रेशियो? What is one more name for cross product ratio? Odds ratio. Odds ratio is calculated from case control study. Odds ratio is calculated from case control study. Like if there is a table like this, cases and controls. Disease present, disease absent. This is case, this is controls. For example, 100 cases, 100 controls. How many are exposed? Exposure. Smoking, yes, no. Out of 100, 80 are exposed. Out of controls, only 20 are exposed. So this is the table. Case control study will be doing. Cases 100, controls 100. How many are exposed in case? 80. How many are exposed in controls? 20. Then give the alphabets. A, B, C, D. So odds of exposure within cases is A by C. Odds of exposure within controls is B by D. Just I am making it in a concise way. Odds of exposure in cases, it is A by C. For controls, it is B by D. If you divide these two things, odds of exposure in cases divided by the odds of exposure in controls, it is A by C divided by B by D. You will be getting AD by BC, that is cross product ratio. What you will be getting is AD by BC, cross product ratio, is calculated from case control study. If it is more than one, positive association. If it is less than one, negative association. Yes, good. Confounding factor is something which is associated with two things and it is distributed unequally between two groups. Then only it will cause distorted association. So for example, confounding factor means, if I am telling like this, coffee consumption is leading to lung cancer. There is a study telling coffee is associated with lung cancer. Is it possible? Coffee, can it cause lung cancer? Is it possible? The study was proving an association between coffee and lung cancer. Is it possible? No, there is no direct relationship. But later when they found that in the study, most of the coffee drinkers were also smokers. Not compulsory that if you take coffee you should smoke. Not like that. Most of the coffee drinkers were also smokers. Smoking was present in them. And that is the reason why there was an association which was indirect. Confounding can lead to indirect association. Indirect association. So smoking is the confounding factor. Why it is confounding factor? Tell me good. First point what I am asking. Yes, very good, Shimo. Correct. Ajira, very good. Coffee. Yes, correct. Coffee. Smoking is the confounding factor because it is associated with exposure and independent risk factor for the outcome. Repeat my words. It is associated with exposure and independent risk factor for the outcome. Independent risk factor for the outcome. It is distributed unequally between the two groups. Then it will cause distorted association. How to make it equal? If I am given a chance, if I am doing a case control study, equal distribution you want to make. How you can make? For a case control study I am asking. Different studies are there, different things can be done. For a case control study I am asking. For a case control study I am asking how it can be done. Matching, yes, matching if you can do, there will be group matching or individual matching which will help in equal distribution of that factor in between them. So now it is unequal, later you can make it equal. Got my point? Good. In case control study you can do matching. There are so many ways of reducing confounding factors. If I'm asking, just write down the ways to reduce confounders. Just I'm giving the list. Just I'm giving the list to reduce confounders. Write one by one. To reduce the effect of confounder, you can do randomization. You can do restriction. You can do matching. So these things can be done during study. Whatever the study, depends on the study what you are doing. These things can be done during study. After study, you can do two things. When you analyze the results, you can do stratification. Stratification can be done, or you can also do subgroup analysis. Subgroup analysis can also be done. So if they ask in detail after study what you'll be using, if they mention these words, they mention after study, what you'll be using. Good. So now tell me, during study, 3 things can be done. After study, 2 things can be done. If at all they ask the best for randomization, the best for removing confounders, I'm asking. Okay, the best for removing confounders. See the sequence properly. Stratified block randomization. There is something called as stratified block randomization. That is better than stratified randomization. That is better than stratified randomization. And this stratified randomization is better than randomization. You can go in sequence. This is better than randomization. So there is an MCQ where stratified randomization and randomization was both in the option. Then your answer will be stratified randomization. If stratified block randomization is there in the option, then that will be the correct answer. And that will be the correct answer. This is the best. 1, 2, 3. If you go in sequence to reduce the effect of confounding factor. To reduce the effect of confounding factor. Green color in a triage. Tell me good. It will go like this, na? Traffic signal. Red, yellow, green, black. This is how traffic signals, when you go and stand in a signal, na, it will be like this. Red, yellow, green, then off ho jayega, black hai. So green color will indicate ambulatory patients. It will indicate ambulatory patients, but highest priority is for red, least priority is for black. Highest priority is for red, least priority is for black. Life-saving surgeries within 6 hours if I want, then I go for red color tagging. What I'll be doing, highest priority is for red, least is for black. Moribund patients, dead patients. Incidence of a disease with respect to time. So exact words, tell me, incidence of disease with respect to time. What you will be using? Line diagram where x-axis will be time usually, y-axis will be cases. How the cases are increasing and decreasing with respect to time. What is this called as? Trend of a disease. What is this called as? Trend of a disease. If I want to plot trend, which diagram is preferred? Answer is line diagram. What is the use of histogram? We will be having continuous bars, na? Frequency distribution of continuous data. Frequency distribution of continuous data. Histogram. Scatter diagram is for correlation. Scatter diagram is for correlation. Bar chart is for qualitative data. Frequency distribution of qualitative data. So now tell me, out of this, if I am asking this question, frequency distribution of quantitative data, what will be using? Frequency distribution of quantitative continuous data, what will be using? Tell me good. Frequency distribution of quantitative data. Histogram, good. Scatter diagram is for correlation. Qualitative data like male, female, India, Pakistan, Nepal, like that, or anything, yes, no, if I am telling, then it is bar chart. Quantitative data अगर होगा तो फिर histogram है. Good. Which is not an indicator related to malaria surveillance. ये भी एक question था. There is nothing called as index. We have incidence, that is parasite incidence, or only falciparum cases you check falciparum incidence, or blood examination rate. Which is an indicator to check new cases, annual parasite incidence. Only falciparum cases, falciparum incidence. Which is an indicator for operational efficiency out of this? Which is an indicator for operational efficiency out of this? Tell me good. Which is an indicator for operational efficiency out of this? Annual blood examination rate more than 10%. It should be more than 10%. The amount of slide collection what you'll be doing now. So it is slides collected by population. So it should be more than 10%. It should be more than 10%. So we express it in percentage. We express it in percentage. So tell me the cycle bird, vector, man. If they ask this question, bird, vector, man. Bird will be the reservoir. Bird will be the reservoir. Culex will be the vector. Culex tritonicus will be the vector. Culex tritonicus will be the vector. Pigs comes in between. Pigs will be the amplifier. If pigs are involved, pigs will be the amplifier. Cattle will attract the mosquitoes. Cattle will be the attractant. Pigs are the amplifiers. Cattle will attract the mosquitoes. Then if that mosquito is biting man, man will be the dead end host getting encephalitis. Man will be the dead end host developing encephalitis. That is the cycle which is related to Japanese encephalitis. Japanese encephalitis. The role of pig will be amplifier. The pigs, they never show symptoms. Remember this word. Pigs are asymptomatic during amplification. Man will be the dead end host, accidental dead end host. Vaccine contraindicated in pregnancy means they are asking live vaccine. Out of the given options, your answer should be varicella. Out of the given option, your answer should be varicella. So indirectly they are asking which of the following is a live vaccine. Which of the following is a live vaccine? Not a personal protective equipment. I think it's 2020 NEET PYQs. So I think it was asked in 2020, which is not a personal protective equipment. So out of this, goggles, face shield, gloves, everything you are wearing, that will come under personal protection. Lab coats, it's not related to personal protection. It will not come under personal protective equipment. Lab coats, fine, it will look good for attendance and all, you need this, but personal protection, it is not the thing. So it's a matter of pride, agree. Paid t-test. Now tell me the answer. Paid t-test is used where? Paid t-test is used where? Quantitative data, yes. One group before, after. Quantitative data, one group before, after. We are using paid t-test. So paid t-test is a type of parametric test or non-parametric test. Paired t-test is a type of parametric test or non-parametric test? Answer my question. Paired t-test is a type of parametric test or non-parametric test? Parametric test, yes, good. Parametric test will be used to compare mean values. Parametric test will be used to compare mean values. So tell me the mnemonic for parametric test, what we have discussed in the classes. If it is there in the notes, yes, tell me. Good. Between two groups, what test? Mean, I am telling. Between two groups, what test? One group before intervention, after intervention, what test? More than two groups, what test? Answer my question. Good. Between two groups, we have student t-test, also called as unpaired t-test. Student t-test, also called as unpaired t-test. What is one more name for student t-test? Unpaired t-test. Unpaired t-test. One group before intervention, after intervention. The same question. Mean value before intervention, after intervention, if you compare. Paired t-test. Hemoglobin was 10 grams. After intervention, it is 14 grams. If I want to check the statistical significance, paired t-test. More than two groups if I am comparing. The outcome variable more than two groups if I am comparing. ANOVA test. Analysis of variance. ANOVA test. These three are examples for parametric test where you will be using them to compare mean values. Tell the mnemonic. Student t-test, paired t-test, ANOVA test. What is the mnemonic? Student t-test, paired t-test, ANOVA test. So what will be the mnemonic? SPA. Student t-test is also called as unpaired t-test or independent t-test. Two different groups, though alag group hai na, two different groups. That is why it is unpaired t-test. Student t-test, also called as independent t-test. One group before, after, it is paired t-test. More than two groups, it is ANOVA. So I think this is the last question for this session. So based on the allotted time, I'll be taking this question now. This will be the last question. Paradoxical carriers, very old question, but what is paradoxical carrier and what is pseudo carrier? Paradoxical carrier is one carrier who gets infection from another carrier. This is the question. Paradoxical carrier is one carrier who get infection from another carrier. But if they ask this question, there is one carrier carrying a virulent agent. There is one carrier who is having a virulent agent. What are those carriers called as? Pseudo carriers. So don't make mistake between two words. One is paradoxical carrier. Other is pseudo carrier. If I am asking this word, the carrier who is having an A virulent agent, then it is pseudo carrier. But here the question is a carrier who get infection from another carrier, then it is called as pseudo carrier. Then it is called as paradoxical carrier. Highlight this word. Person who got infection from another carrier is called as paradoxical carrier. Usually we make mistake in these two things. P for paradoxical, P for pseudo carrier. So total around 52 questions was supposed to be discussed, and we have finished the session. We have started at 8 o'clock almost. So we have tried to cover all the previous year topics in concise mode. The main purpose was not making it too lengthy for you, because it is more of a revision session, that too question answer session, making it more concise. So fine, based on the option person carrier, it is fine, you can take it. Option B is the correct answer. Option B is the correct answer based on the recall, based on the recall. So all the best, take care. So anything you want to discuss, so there is nothing to worry now, because there is nothing to lose also. If you have not scored well in INICT, that has nothing to do with NEET exam, totally different things. So just always keep one thing in the mind, there is nothing to lose in life, always everything is to gain, because you have come so far, so just keep this word. Any day, any time, either you are in the floor, either you are in the sky, fine, but always there is one more thing to gain, always. So there is nothing to lose, so keep on gaining something, have that hunger with you. Usually I'll be using the two words whenever I'm signing something: nothing to lose and hunger for survival. This is my words usually when I am writing something. These two things, usually it keeps me also pushing somewhere towards something. Like, there is nothing called as perfection, there is always the way to improve, there is always the scope for improvement. Just keep on doing something which is better than yesterday. Nothing to lose, hunger for survival, these two words which keeps me going always. All the best. Any doubt, you can insta me. Usually we'll be using Instagram most of the times. Keep smiling, the Rajeev Shetty Instagram, you can use it. All the best, take care, sweet dreams. All the best, take care, sweet dreams. Thank you so much. So anything you can ask, sir, I'm having this problem, so what will be the solution for that? Sir, I'm having this, so can you help? You can always text me in Instagram. I'll be usually active, so I'll be texting you back. So whatever possible from my side, whatever the solution we can do, we can discuss and get one solution together, because there is not always a solution. If there is no problem, then there is no solution only. So problem, it's about how we deal with it, the maturity, so just keep it simple, there is nothing to lose. Have that hungerness within you, the universe will feed you. If you are so hungry, the universe will always feed. It's about the hunger. The more hunger you show, the more thirst you show, the more you'll be fed. That is what I want to say. The more hunger you are showing, the more you'll be fed. It is more than enough. Means, sir, today if my stomach is filled, tomorrow, no, tomorrow also again the hunger will have that. It is physiological thing, The word hunger is physiological. There is nothing pathological in this. So having that hunger to improve, there is nothing wrong in that. It's not about perfection, it's about improvement, what I'm telling, You need to improve. There is nothing, there is no point to prove to anyone. We are not here to prove to anyone, because everyone is unique in this, So all the best. Here Kulladara, sir. What is that? Tulu, Tulu language, Incha Ullara, sir. Some student typed me Incha Ullara, sir. Here Kulladara, ಈ ಸಲ ಕಪ್ ನಮ್ದೆ, ನೆಕ್ಸ್ಟ್ ಸಲ ಪಕ್ಕ ನಮ್ದೆ. That is what I want to say. Next ಸಲ ಕಪ್ ನಮ್ದೆ ಪಕ್ಕ. Every year we are waiting for the cup, So unless and until we get something like females, yes, we won in RCB this time. We won females, good. So expired cytotoxic drugs. Yes, cytotoxic word, it is yellow color, When the word cytotoxic comes, it is yellow color. Acha, Voltara, Udupida, this good. If you are taking too much of this word, this name, you are taking too seriously, Shetty. So you are typing everything in Tulu, Tulu Nadu. Good. All the best. All the best. All the best. So PDF, I think I'll be checking this. It is converting into PDF, The session is getting converted to PDF. Maybe I'll give it. But it will take maximum 45 minutes to see the session in 2x mode if it is there. Glass cytotoxic word, if it is coming, it is yellow color. It can be glass, it can be anything. The word cytotoxic comes, na, it is yellow color. Metazoonotic, I have not come across this word, metazoonotic, na. Epizootic, I know. Enzootic, I know. Metazootic, I have not come across this word. You discuss with microbiology faculty if possible, or else I will check this word, metazoonotic, na. What I know is epizootic, enzootic as of now. So have your dinner, then we can discuss few things. If you can ask me in Instagram also. All the best, take care. So anything, the results, I'm not telling it will be good or bad. Whatever the results, you just text me back. Sir, I got this, I'm happy. I'm having this, I'm happy. Like whatever you want, you can text me back. All the best. Take care. Thank you so much.